Hello, we are Group 10 and we are going to talk about Kleptomania, and this is our group members. Hello, my name is Ifa and I'm going to talk about Kleptomania today. So, what is Kleptomania? If you guys have never heard of it, it's actually a recurrent inability to resist urges to steal items. In much simpler words, it basically means that people with kleptomania, they have to steal because of psychological compulsion in their body. So people with kleptomania, they usually steal things that they actually can't afford to buy it. They have this like urges to steal it, like no matter what I have to steal it. That's how they feel. Makes kleptomaniacs and criminal thieves different is that the value of the things that they steal. For example, for kleptomaniacs, they steal things that have little to no value at all, while criminal thieves usually steal things that have much value. So that's how it differs from kleptomaniacs and criminal thieves. Mania is a rare disorder, but it can be serious if it's not treatable. So that's why we have to do awareness on this disorder. I'm now going to talk about the statistics, data, and prevalence of kleptomania in Malaysia. However, though, I have to disclaim first that kleptomania is not generally known in Malaysia. So, after days and days and days of researching and trying to finding everything on the internet, me and my group members have decided that we cannot find it. But however, though, we found an journal article about a conduct disorder of kids under 18 years old, since our case study is about Amy of 13 years old. And in the journal article, it was written that there are almost 5,000 cases of teenagers under 18 years old who suffers from conduct disorder. Thus, that is our closest data about kleptomania, even though it's not the exact one, but I think that's the one that we got. Yeah. I'm sorry, doctor.
Amy was addicted to steal the belonging of her relative. She also had stolen candies, stationeries, and toys from the local shop. Even she was affordable to buy the things. Amy preferred keep the stolen items under her bed until her mother found a box of them. Amy's mother stated that Amy had been stealing since she was a child and thought that she was just being naughty. However, the habit of steal persisted until she grew older.
According to DSM-5, the individuals who suffer from kleptomania will show several symptoms such as the inability to resist the urge to steal, and moreover, the reasons for stealing is not because of personal gain or monetary value. Another symptom is that the individuals will experience a sense of anxiety or also tension before committing the theft, but at the time of committing the theft, the individuals usually will feel a sense of relief or also gratification. Last but not least, the individuals with kleptomania must not steal because of seeking revenge and must not due to hallucination or delusion. According to the news, Amy, who was 13 years old, was addicted to steal her relatives' belongings and also toys, candies, and also stationeries from the local sundry shop, although she was actually affordable to purchase the items. Occasionally, kleptomaniac individuals may keep or also return the stolen objects. So in this case, Amy, she prefers to keep or collect the items where her mother found out a box of items under her bed. Based on DSM-5 too, kleptomaniac individuals usually never plan the theft and they usually done the stealing alone without the help from others. Moreover, they are ego dystonic, which means that kleptomaniacs are aware that their behavior is wrong, and that is why their behavior of stealing usually cause anxiety, frustration, and also guilt. The symptoms of kleptomania usually begins in adolescence, but it may also begin in childhood or adulthood. So according to our case study, Amy's mother stated that Amy had been stealing since she was a child, and she thought that she was just being naughty. However, the behavior of stealing persisted until she grows older, until she was 13 years old and was diagnosed with kleptomania.
Hi, my name is Anika Philip. People at risk for factor for kleptonia are people with mental disorder. There are three causes of kleptonia that are viewed from point of view of psychology. Among them are psychoanalysis, cognitive behavior, and biological. For psychoanalysis, kleptonia sufferers have to steal in order to release their addiction. Kleptonia risk factor may be due to be sufferer having other mental problems such as sleep disorder, eating disorder, sexual disorder, and so on. For cognitive behavior, people with kleptomania will be accustomed to stealing when they have a feeling of peace and getting satisfaction during the first time stealing. The feeling of wanting to repeat the act of stealing will arise because of the first successful attempts and consider the art to be gives something positive. Lastly, biological. People with kleptomania occur due to decreased level of serotonin and chemical compound of the brain that works to influence emotion and mood. People with mental problem are easily disturbed emotionally and even difficult to anticipate. An unbalanced brain opioid system causes the desire to stay high and it difficult to overcome. Here, kleptomania sufferer cannot think rationally.
An individual with kleptomania might not seek help because they feel embarrassed of what they have done. However, this could lead to other complications as well. Kleptomania does not only affect the victims themselves, it could also affect the victim's family or the institution or person that has been stolen from. According to the article, Kleptomania, Diagnosis and Treatment Options, the victim might feel shame and guilt despite the feelings of gratification they get from the act of stealing. This could cause strong emotional distress in the victims. Besides that, there are also other problems that could arise from not treating kleptomania, such as financial problems, lawsuit problems, and the relationship between victims and the people around the victims could really be affected as well. All of those could contribute to the victims developing other conditions such as impulse control disorder or eating disorder, suicidal ideation, anxiety, depression, personality disorder. Therefore, I strongly suggest those with kleptomania to seek help and get diagnosed even if they feel embarrassed, because it could really help them avoid all the complications altogether and to be able to function better in life even though they have kleptomania.
And we found that the primary treatment for kleptomania is psychotherapy. The thoughts and behaviors that contribute to theft are the subject of cognitive behavioral therapy or CBT. CBT may include techniques that can help to control the kleptomania urges, which is first is covert sensitization, in which you imagine stealing yourself and then experiencing harmful consequences such as being caught. And second is aversion therapy, in which you perform unpleasant procedures such as holding your breath until you feel uncomfortable when you are tempted to steal. And third is systematic desensitization, which you practice relaxation and visualization strategies that inhibit the urges to steal. However, while getting treatment from professionals, the client also could use the coping techniques or skills by learn about kleptomania to understand better about treatments, risk factors, emotions that trigger the stealing behaviors. And also, she could rechanneling the urges by doing exercise or leisure activities. Last but not least is stay focused and motivated by keeping the recovery goals in mind.
In conclusion, kleptomania, a largely unrecognized disorder, presents as a chronic illness for many individuals and causes significant psychological, social, and legal repercussions. Since presentation specifically for kleptomania is quite rare, and it is important that clinicians recognize the disorder and screen the patient appropriately. Various treatments have been helpful, and the small treatment, but more research examining etiology and the treatment is needed.
That is all from Group 10. Thank you for watching.